This week's live video was connected with a fluid volume deficit. The first question is, what are 5 different labs that can indicate fluid volume deficit? First, blood urea nitrogen, urine specific gravity and osmolality, hematocrit, hypokalemia, and hyponatremia. What are electrolytes and their purpose? Electrolytes are electrically charged minerals and compounds. They help to produce energy and contract muscles in your body. What are expected reference ranges for sodium? 135 to 145 milliequivalents per liter. For potassium, 3.6 to 5.2 millimoles per liter. Magnesium, 1.5 to 2.5 milliequivalents per liter. Calcium, 8.5 to 10.5 milligrams per deciliter. Chloride, 96 to 106 milliequivalents per liter. Phosphorus, 3.4 to 4.5 milligrams per deciliter. What are signs and symptoms of hyponatremia? This includes nausea and vomiting, headache, confusion, loss of energy, drowsiness and fatigue, restlessness and irritability, muscle weakness, spasms or cramps, seizures, coma. Signs and symptoms of hypernatremia include a strong feeling of thirst, weakness, nausea, loss of appetite. Severe symptoms also include confusion, muscle twitching, and bleeding in or around the brain. Signs and symptoms of hyperkalemia include muscle weakness, numbness and tingling, nausea and vomiting, irregular heartbeat, shortness of breath, and signs and symptoms of hypokalemia include weakness and fatigue, muscle cramps and spasms. The muscle cramps are sudden, uncontrolled contractions of the muscles. Digestive problems, heart palpitations, muscle aches and stiffness, tingling and numbness, breathing difficulties, mood changes. Signs and symptoms of hypomagnesemia include convulsions, apathy, muscle cramps, hyperreflexia, acute organic brain syndromes, depression, generalized weakness, anorexia. Signs and symptoms of hypermagnesemia include weakness, nausea, dizziness, confusion, decreased reflexes, worsening of the confusional state, and sleepiness, bladder paralysis, flushing, headache, constipation. Nursing care and management of hypernatremia include: you should offer the patient fluids and water frequently. Avoid caffeinated fluids and alcohol because they can increase the serum sodium level, which causes water diuresis. You should notify the physician of any changes in mental status, including agitation, confusion, disorientation. Nursing care and management of hyponatremia include: the first line of treatment is a prompt IV infusion of a hypertonic saline. Nursing management and care of hypokalemia: you should place the patient on a high potassium diet. If your increasing dietary potassium is insufficient to treat moderate hypokalemia, you should provide oral potassium supplements. A patient who has severe hypokalemia or can't take the oral supplements may need an IV potassium replacement. Nursing care and management of hyperkalemia include a diet low in potassium for mild cases. Discontinue medications that increase blood potassium levels. IV administration of glucose and insulin, which then promotes movement of potassium from the extracellular space back into the cells. Nursing care and management of hypomagnesemia is oral magnesium salts, magnesium gluconate 500 to 1,000 milligram orally for 3 times a day, and is usually given 3 to 4 days. Nursing care and management for hypermagnesemia include an IV calcium supply, which is used to reduce symptoms such as an impaired breathing, irregular heartbeat, hypotension, and any neurological impact. Intravenous calcium, diuretics, water pills can also be used to help rid of the excess magnesium. And people that have renal dysfunction or those who have had severe magnesium overdose could require dialysis if they begin to experience kidney failure or if after treatment the magnesium levels are still rising. And the last question, a nasogastric tube is attached to low intermittent suctioning. The nurse should monitor for which of the following electrolyte imbalances. In this instance, the nurse should monitor for hyponatremia.